On the 17th of December, your tenure as Taoiseach will come to an end, or at least for now. By that time, you will have been 33 and a half years in this House as a TD. That is some achievement. So is reaching the highest political office in this land, Taoiseach, and I think it would be churlish not to congratulate you for that. But my question, Taoiseach, is, from your experience and your tenure in this House, can you tell me how the people can affect change? Because we elect representatives to make decisions on our behalf, or we have referenda. I have repeatedly raised the issue of UHL with you and with Deputy Minister Donnelly beside you, and indeed with Minister Harris beside you during this Dáil, as have the other representatives of Clare, Limerick City, Limerick County and the broader Midwest. This week, Taoiseach, we learned that 72 NCHDs wrote a letter, made a protected disclosure rather, highlighting a series of near misses at the hospital. They said patients have to wait more than 10 hours for a bed in the unit without any medical attention, while other lost patients are sometimes missed and left unseen by a doctor for a number of days. They say many NCHDs don't want to work in UHL and actively avoid it because of the working conditions. Many people in my constituency and neighbouring constituencies don't want to go to hospital there. They're afraid to go to hospital there. Most worryingly, Taoiseach, they say that there is a great concern among staff about escalating clinical incidents or important issues to management. There is a fear of retribution or informal punishment should a person be identified as suggesting change or discussing pertinent issues in UHL. Now, Taoiseach, a similar letter, not a protected disclosure, but letter was written last year. And my understanding is that there was a witch hunt by senior management to find out who wrote it, where they worked, and where they intend to work in the future. Now that's worrying, Taoiseach, because I've raised these issues in UHL with you repeatedly, and you have said it's not for this government to manage a hospital, it's for the HSE and it's for the management. But I've repeatedly asked you if they're not managing it adequately, and it would appear from this protected disclosure, it would appear from the letter written last year, and a letter by senior consultants, which I also brought to your attention, that the system isn't working. So how do we effect change? Because I accept it is for management and HSE to run hospitals. But when they're not doing it, what happens? I could highlight other incidents. I mean, you know, I highlighted the National Driver Licence Service. A resolution was passed unopposed by this House. Unopposed by this House. But nothing has changed, Taoiseach. There was a similar, you get one of these from the Count Corla's office. It's nice, it's yellow, it kind of represents parchment. But that's the extent of it. There was a COVID committee, Deputy Devlin behind you sat on it, even Deputy Donnelly, before he became Minister, sat on it. That produced a report. Yet nothing has happened. No accountability for the billions spent, some of it squandered, a lot of it squandered. Not all of it though, but a lot of it squandered. For the deaths in nursing homes, no accountability. So how can the people affect change, Taoiseach? How? Because if democracy doesn't work, then the centre doesn't hold. And it's something that you've highlighted a lot yourself, the importance of democracy, the importance of the centre holding. But the centre has to respond to legitimate concerns for that system to work.
Thanks, Deputy, for raising this very important issue, and I appreciate your interest in my longevity in politics. But actually, in a serious vein, I think you have to keep working hard to effect change. All of us do. We have to keep at it. And what's interesting over that period, actually in the last 20 years, 25 years, health has transformed. There is no comparison between outcomes, survival rates today compared to 20, 25 years ago. And I said this yesterday in the House, and the reason was we took a more strategic approach to the big diseases that were killing people. There's a number of aspects to health. There's access, which you touched on, and how people are treated in emergency. But there's also how do we increase lifespan? How do we increase quality of life? How do we reduce the burden of disease on people? To me, that is the big story in health, which always gets lost in the most immediate headlines. And that's frustrating for a lot of people working. I spoke to a stroke, I mentioned it yesterday, a consultant. And he put up a story on Facebook last year in terms of almost miraculous intervention with a patient through thrombectomy, and the patient got to hospital in time. He got 1 million views. The point he was making to me was, we don't communicate events like that. It just took off because it was a very good story how a person was saved through modern methods of dealing with stroke, but also a better strategic approach to dealing with stroke in terms of stroke units. The cancer strategies have been immensely successful. The centralization of cancer in centres and so on. Cardiovascular strategy has been very successful. However, numbers are growing in terms of population is growing, and in my view, I feel that services have not grown over the 20-year period to match population growth. That would be a view I'd have, and I think that manifests in health also. So, in terms of the specific issue, my understanding is protected disclosure might have been sent in June. I stand to be corrected on that. The Minister has met with the NCHDs concerned, and there has been, as you know, the HSE Performance Management Improvement Unit led an intensive engagement with the hospital group and the Midwest CHO throughout the summer in response to how the hospital was functioning. Because to be fair, it wasn't just NCHDs, I think he also raised issues in relation to the hospital. They worked with the UHL to support oversee the implementation of rapid improvements in services in the region. These measures include a renewed focus on hospital avoidance, patient flow, discharge planning, regular frequent assessment of patients with long stays. That performance management improvement unit is still supporting the UHL, and that remains work in progress. There is a bespoke site-level plan for Limerick as part of the National Winter Plan. They do need more consultants. The recruitment of extra staff, 2 emergency medicine consultants, discharge coordinators to target patient flow, that's now happening, and they're being hired. Improving access to diagnostics in the emergency department, the enhancement of GP out of hours, committing to the presence of senior decision makers on a 16-hour day, 7 days a week basis. And just to point out finally, the workforce in UH in Limerick has grown by 833 full-time equivalents. That's about 29% of an increase.
Dr. McNamara.
Taoiseach, this issue was raised repeatedly in this Dáil. So why did it take a protected disclosure for the Minister? To meet with the staff there, and what is actually changing, because we can remouth statistics, but the biggest single change, you talked about changes over 20 years, the biggest single change over 20 years is that people in Clare do not want to be brought to that hospital. That's a big change. People on the street, in the countryside, do not have confidence in that hospital. NCHDs do not want to work in that hospital. Taoiseach, at this stage, it should be evident that it is not working. And you can pour as much water as you want into a leaking bucket or throw as much money as you want at a system that doesn't work, and it simply doesn't improve it. So my question is, will management structures, I don't want to talk about individuals, but will the management structures of this hospital be looked at? Because until we do that, the profound change required will not happen.
Taoiseach, to conclude.
I think I understand fully where the Deputy is coming from. There has been huge pressure on that hospital over the last number of years. The workforce has increased. I went through that with you. The budget's gone up 20% in 1 year alone. In 2022, it's 315 million now. That's an increase of 19%. From 219, sorry, not in 1 year. And then we also, the new 60-bed modular was put in 2021. That opened, and there were rapid build projects, and there will be further developments. Work has just commenced on a new 4-storey 1996 single-bed acute inpatient ward block. That has to happen. I know you're saying we're pouring more. Limerick is the key hospital in that region, so we have to work to improve. Yeah, and we have to work to. Well, no, in the southwest it's CUH, essentially. Okay, you have Mercy now, but the CUH is the tertiary. No, it's it's bigger population. It doesn't matter. Like we need to resource and advance Limerick more. We have to, and it does need more capacity, both in terms of personnel and in terms of facilities and beds. And so forth. But also then the enhanced community care side of it is very important also. That we reduce people who don't need to go to A&E departments. I think is very important that they would have proper good quality care in different sites and different centres.